Assalamu alaikum rahmatullahi ta'ala wa barakatuhu. Dear brothers and sisters in Islam, today we shall be talking about peptic ulcer disease. This is generally called ulcer. Peptic ulcer disease is as a result of ulceration or a wound on the mucous lining of the areas that it affects. And these are mainly the stomach and the duodenum, although it does affect other areas which I would not take you through. Now, what would cause this peptic ulcer? Because there are so many myths in our environment. Everyone thinks, oh, it could be caused by eating too much pepper, it could be caused by not eating at all or by fasting and all that. But indeed, what actually causes peptic ulcer is a lot far from these myths that we all have come to believe. Allah subhanahu wa ta'ala has made in the stomach and in the duodenum some preventive measures, some protective measures that will keep these areas free from injury. And these would include the way that Allah has made the cells lining these areas. Now, if this protection, the normal protection in these areas are eroded or overwhelmed, then there could be an injury leading to a wound, which we then refer to as an ulcer. Again, in the area of the stomach, there is a production of acid, which the stomach requires for its functions. If there's so much production of acid that it overwhelms the other measures that have been put in place by Allah to protect this lining of a stomach and the duodenum from injury from acid, then it could also result into acid. So if a person produces too much acid or too much of another chemical that we call pepsin, then the individual could then end up with ulceration. Again, sometimes during diagnosis, and for you to say you have an ulcer, proper diagnosis must be done. Now, during diagnosis, the washings of a stomach lining may be collected, and there is often an organism called Helicobacter pylori. If this is also present in the stomach, it may also add to the fact that the individual may become predisposed to ulceration. How do you know, how does a patient present? Most often the patient will say, oh, I have this gnawing or pepperish feeling in the upper part of my abdomen. Or they may say, oh, the pain will never go away until I've eaten. Some patients say this pain wakes me up in the night and until I've taken milk or I've taken some food before I get some relief. Of course, some people would say, oh, it's after I've eaten that this pain comes. In whatever way it presents, once it's peptic ulcer disease, then the individual needs to be properly diagnosed and properly treated. You need to be careful. If you notice that the stool that you're producing is darkly colored or it's smelling, then you might actually be bleeding. This is one of the complications of peptic ulcer disease. In such an instance, you may want to refrain from fasting. You may also want to refrain from taking drugs that have not been prescribed for you, because you would find that individuals could easily gain access to these drugs like aspirin or aspirin-containing drugs, which would even make their condition worse. So for peptic ulcer disease, the first thing to note is that you must be properly diagnosed, you must not take drugs unless they've been prescribed, and you must take those drugs that have been prescribed. This is the much that we can take this segment. Next time I come your way, we may have the opportunity of going further into this discussion. Assalamu alaikum.